Welcome to the webinar series on sustainability transitions in the context of COVID-19, perspective from Global South. So we're just giving a few minutes for more participants and scholars, colleagues to join. We are around 24 already, so that's a very interesting number. Wait a few more minutes. We thought it would be interesting just to tell you who we are and what we're doing. We are part of the Sustainability Transition Research Network, that is an international network of over 2,000 scholars. And within this network, we are a thematic group that is interested in the transitions on Global South. Also, we just wanted to mention that this webinar series is supported by TIPSI, it's Transformative Innovation Policy Consortium. And for those who were already here, have been here before, and for those who are joining in for the first time, we just wanted to remind a little like the dynamic of how the webinar goes. So please feel free, everyone, to introduce yourself on the chat box. If you already have any kind of question, there's also a Q&A chat box, a Q&A box where you could post or drop your questions there, that Vipashi and Katerina will kindly collect them afterwards when the time for questions is available. We are also gonna share the Google form link for everyone who is interested in showing their, or participating in further webinars that we do. So if you're interested, just complete the form. And please remember to vote for the question that you find the most interest, because we're gonna pick, that's gonna help us to pick up the questions from there. Also, I think it's worth mentioning that our hashtag is #GlobalSouthWebinar. I'll say that again just in case, #GlobalSouthWebinar. Let me see how many people we are at the moment. With 33 participants, amazing. We're gonna just wait a few more minutes. We had a very successful previous webinar. Introductory webinars where scholars were asked what were their interests or future editions or events that we're gonna host, and the highest interest was shown for today's webinar, that is on impact of and resulting inequalities of COVID-19 in the Global South. I don't have to forget that we're also streaming in our YouTube channel. For those who are watching us throughout your YouTube channel, please remember to use the chat box. We will also be collecting questions from there. And we have a very interesting panel today. We are going to be hearing from Dr. Kia Chakraborty, from Felix Cuavena Doncor, who is still joining us, and from Melina Galdos Frisancho. I think that, well, throughout this panel, we will see the diversity of the challenges around Global South, and we really look forward for the discussion. So again, please feel free, drop your questions, participate. Let's do this dynamic. We're gonna have a 20-minute talk and afterwards 10-minute discussion. I'll be keeping track of time, so if you hear me, don't get afraid, because I might just drop in like 1 minute or 2 minutes left, just for the sake of time. So we are 6 minutes past the time of the beginning of the webinar. So first hear from Dr. Teya Chakraborty. She's a faculty member at Srishti Manipal Institute of Art, Design and Technology from Bangalore, India. She's postdoctoral researcher at Urban Transformations Lab, Sunku-Wan University, South Korea, and Sister Indian Institute of Science from Bangalore. She's also a PhD in urban planning from Indian Institute of Technology, Kharagpur, India. And she's going to talk about the impact on human development indicators due to COVID-19 pandemic in India. So, Kia, are you there? Can you hear us properly?
Yeah, could you hear me?
Yeah, I can hear you properly.
Okay, thank you so much. Thank you so much, the team of Transition in Global South. So I really like this topic. This topic is really very close to my heart. And yes, directly going to the topic. So let me share my screen. So is it visible? Yeah. So yeah, as May said that my topic is impact on human development indicators due to COVID-19 pandemic in India. So hello to all. So wherever you are, I think you are safe and doing good. And this topic for India is very crucial because of the present situation. So Global South had its own, characteristics, its needs, in its priorities, and the way of solving the problems. And sometimes really it's different from the other part of the globe. So India as a country has a lots of diversity in terms of the geographical terrain, in terms of its culture, in terms of its way of living, and even it is reflected in socioeconomic sector as well. So if we see our growth in last 30 years, we could see that GDP has increased for 4.7% annually, and we have reduced our absolute poverty. But important thing is over here that this decrease of poverty comes from the movement of individual person just below the poverty line. So faster growing states, mainly like Karnataka, Tamil Nadu and all, so they have reduced the headcount ratio of the poverty, that is a number below just the poverty line, and individuals living below poverty line, and they moved actually above the line. So, but the important thing is the intensity of the poverty has not been affected much, and those who have remained poor, they actually remain poor chronically. And most important thing for India is a kind of spatial concentration of the inequality due to its geographical diversity. So largest contribution factor is the rural-urban dictum, because we have seen since 90s, there is a lot of changes, a lot of diversity, or you can say a lot of inequality between urban and rural area. And also poverty is increasingly concentrated in the different areas geographically. And if we see different states, then we could see that there are lots of differences or inequality among the states, like we can name it as a destination states and source states. Destination states are prosperous states in terms of well-being and all. So Maharashtra, Andhra Pradesh, Karnataka, Tamil Nadu comes under those states. And it is amazing that they are contributing 40% of the GDP, national GDP, but they are contributing only 27% of the population. Whereas this source, states like West Bengal, Uttar Pradesh, or Odisha, or Bihar, they are contributing only 20% of our national GDP, but they are the share of population share is only 36%. So these are the inequality you can see over the states. There are the small statistical brief I like to share over here, that according to Oxfam report, that top 10% of Indian population holds only 77% of the national wealth, whereas 73% of the wealth generated in 2017 went to the richest of only 1%, and 67 million Indians who comprises the poorest half of the population. So only 1% increase in their wealth. So continuing with this inequality in the economic sector, due to this pandemic situation, the most sufferer are the migrant and the laborers, because they have already started losing their jobs in because construction sites are closed already, and other daily earners like cab drivers, housekeepers, maintenance staff, factory workers, they are also losing their jobs, and without job, they have no money, no food, no shelter, and they are moving towards their hometown and villages. And sometimes these are hundreds of kilometers. They are walking like anything without any public transportation, sometimes back. And these are the most difficult time for them, because we heard many accidents for this scenario, for this situation. And if you think about the large companies across the sectors like media, aviation, retail, hospitality, and automobile, they have already announced massive layouts for recent weeks. And for other expert already this means told that they have already predicted many small and medium businesses are going to shut down for some time. So we can say that this pandemic affects that segment of the society who typically cannot be perform their job remotely and are losing their means of livelihood. So this is another kind of small research report that it's kind of in a peculiar trend. We could see the inequality gap in India is expected to narrow after the COVID pandemic. Even as per capita income, that is PCI, is projected to decline by 5.4% during the ongoing fiscal year. And it is typically attributed to the likely higher PCI decline of around 10 to 12% in rich states like Maharashtra, Tamil Nadu, and compared to the less than 8% decline for the relatively poorer states like Uttar Pradesh, Bihar, etc. But in a nutshell, we can say that in reality, India has become more unequal over time because of this pandemic situation. So here is the kind of diagram that is talking about the human development indicators I have chosen. So the three pillars of human development indicators strongly correlate with the SDGs. That is already I have talked about the decent standard of living, that is economy. It is related to decent work and economic growth. When we are talking about the health sector, that means long and healthy life, that is related to good health and well-being. When we are talking about the knowledge, that is quality of education. So these three things are the pillars of any societal well-being, and SDGs also talked about. SDGs they are also strongly believe these three indicators should be maintained properly within any country. So already I have discussed the economic situation in our country during this pandemic, and as well as the history of it a bit. And if we see the health sector, we could see that in India, for 10,000 people, 8.5 hospital beds are available with 8 physicians. And in addition, above 80% of the population still does not have any significant health insurance coverage. And approximately 68% of the Indians have limited or no access to essential medicines. So this country's healthcare sector is not equipped with this kind of crisis, health crisis. So in detail, we can see this if we take the cases for newborn and maternal health. So as the main focus has shifted towards pandemic that caused the disruption to the global pharmaceuticals and medical supply chain, so essential maternal and newborn health services are affected really bad. It is a really bad situation as of now. So as the case for antenatal and postnatal, and even in unattended child delivery is happening in remote places due to lack of transportation. So if you see the children, if you take the case for children, so 3 lakh children, it's as per John Hopkins and Bloomberg School of Public Health, as per their report, 3 lakh children could die in India alone because of this situation. And there are lack of routine services, vaccination for measles and cholera, and preventive and curative services. These all are basically disrupted because of this pandemic, and this state health facilities focused on basically mitigating the impact of this virus. So many children who needs the support from the state government hospitals, they are devoid of that's the support. So due to massive loss of jobs, this is another perspective. Due to massive loss of jobs and decreased rate of incomes, poor families are finding it very, very hard to provide nutritious meal to their children. And not only that, food prices are increasing daily, and there is a disruption in the transport link with the market, and marginal people, again, particularly in the urban areas, are faced with a growing threat of food insecurity. So a large number of children, in a way, who previously relied on state-run lunch program, we will discuss more in education sector. So this midday meal scheme in India are no longer benefiting for this government schemes, and these children are not getting any help from this schools. So there is a statistical brief on that. It says that if health intervention are reduced by around 45%, so if it's reduced by 45%, then there could be as much as 44.7% increase of under 5 child rate and 38.6% increase in maternal deaths per month. So this is a kind of report, statistics, they are saying it can happen if this kind of intervention happens. Intervention in terms of vaccination, in terms of services, all other kind of services. So if we see the cases for senior citizen and other patients, so currently in general, the healthcare sector in the country has taken a major hit, as I said, due to this pandemic. So major public health have been converted to corona centers. So routine outpatient clinics and the routine surgeries are not working as before. And chronic patients who basically need the regular healthcare services are suffering a lot. And the healthcare facilities are seeing a surge of preventable emergencies and non-COVID-19 deaths due to unnecessary delays in treatments like gallbladders burst, avoidable sepsis, fatal heart attacks, critical renal patients due to missed dialysis, and many other things. So situation is complicated. Situation a bit complicated. And if you see the most vulnerable part, that is a young adults. So over there also, stress, high level of stress intensified among them because of the restricted movement, because of closing of school, because of isolated location. And reports said there is a child help online help is there launched by government. So they marked that there is an increase of number of calls they are getting regularly, and 30% were related to violence, child sexual abuse, child marriage, and child labor. So this is the case for health. And if we see the education sector, so it's a kind of loop we could see. So starting with the children again, so 320 million students have been affected due to this pandemic. And though the government quickly recommended shifting to the online teaching and also, but situation is not good because many teachers are not well equipped with the online things. So only a handful of private schools could adopt this online teaching methods. And on the other hand, low-income private government schools have completely shut down because of this. They can't access actually e-learning solutions. So kids are missing the opportunity for learning as well as healthy meals during this time, and they are subjected to economic and social stress. So it's another statistical brief is 28 million preschoolers are now not getting their midday meal, that is called Anganwadi centers in India. And several hundred schools are designated as a quarantine accommodation for workforce coming from other states and other countries. And it is also very important to note that once school will open, then community will have to ensure that these spaces are adequately disinfectant for the kids. And if we see about the higher education part, this pandemic has significantly disrupted the higher education sector because this is a, it is a very important and critical determinant of any country's economic future. So a large number of Indian students, they usually enroll to universities in abroad. So in this situation, they are now been barred to go over there. And if this situation persists like this in long run, there will be a decline in the demand for international higher education. So big concern is that another concern actually that recent graduates also in India are fearing withdrawal of job offers from corporates because of this current very uncertain situation. So another perspective is that above 90% experts already discussed, and they have shared their reports that they believe that due to this lockdown existing gap, due to this lockdown, the existing gaps between the low income group and the high income group or the moderate income group, this will become more critical, and it will make the situation more worsen. And this has implication for the future employment opportunities, as this young will not get a good job, and they will after some time they may have to face the situation of no job. So it's a kind of vicious circle or a loop, you can say. So going to the next slide, it's about the basically government is trying to make the entire society, means not only central government but also the state government and the other private players like NGOs and CBOs. They are trying to make the situation more kind of not say that comfortable, but they are trying to make the situation sustainable. They are trying to make the society sustainable. They are trying to do collaborative work, and this many things are going on in different parts of India based on its based on its needs, its priorities, its emergencies. So like that, for continuation of learning, so and for supporting the students, so government has launched a few e-learning portals. I have given the names for that, and there is very interesting thing that Punjab government has done already. Here, Punjab government launched educational TV, and for the targeting the early graders. And compared to smartphone-based EdTech, ETV is more accessible, easier to produce, and has more rigorous evidence to back it up. And even few states like Madhya Pradesh, Jharkhand, Odisha, etc., they are using the alternative means that is called radio and phone calls and television because for the children, because they are using the local cable channels, and there are very kind of poor access to the internet. So when we are discussing about the quality of internet and access of internet, there is a small report we have got that is National Sample Survey of 2017-18. So it has reported that 23.8% of Indian households had internet access, and in rural areas it is only 14.9%, and in urban area it is 42%. Again, there are some imbalance between or you can say the gender bias while using this internet access or using this smartphone. And recent report says that only 12.5% internet internet is used by the young people, and for the students it's even less. So this is a situation for the e-learning in India, but there are several NGOs. They are really working hard on this field. They are giving educational support in terms of scholarship. They are helping women and the kids for their early development and empowerment. And also very interesting thing that some NGOs are thinking of to empower village. I really liked it. Really like this their thought process that if it takes a village to raise a child, we must empower the village to teach the child. This is very important for Indian context. So we can say more improvement is underway for this educational sector. And for this health sector, if we see that there is again some inter and cross-sectoral linkages already happening for government and private players. So, for example, I can say that Kerala has improved a lot. Kerala government basically improved a lot, and it's improved its technical quality of public hospitals, government hospitals. And since 2005, it is investing more for this particular sector, and people from any background can come for their treatment. So this is really a kind of model for other states. And we came to know a few days back that there is a temporary COVID-19 hospital launched in Delhi for 1,000 beds and 250 ICU. So these are the activities government is doing for cope up the situation. And there are NGOs who are working for for other sector of the health. Say, for example, they have already launched malnutrition clinic and supplementary feeding for women. They are also closely working with the government in terms of providing food relief, in terms of supplying hygienic kits, then supporting an establishment of the quarantine facilities, and providing materials like soap, hand wash, etc. So coming to the last sector, this economy sector. So again, over here, there are NGOs who are working in this sector with the help of, as I already told, with the help of kits, and they are using those kits for the remote area. And they are also offering meals to the migrated workers, daily laborers, and security guards, and many people means who are daily earners. And it is very important that in India, uh, uh, the society, India Psychiatric Society, they have given us the warning kind of thing regarding the health cases, mental health cases, because it includes anxiety and depression. It has risen 20% since the lockdown has announced on March 24, and it is attributed to the decline in the societal activity and restricted movement. And there are more NGOs who are working on this field, and they are doing some work with the government and to the people, having some telephonic survey, mobile counseling, and psychological support for the marginal people. So
yeah, we just only have 1 more minute, please.
Okay, can I get 2 minutes more? So I'm almost done.
Right? Yes, of course.
Okay, yeah, thank you, May. So yeah, so finally, if we discuss about this daily labor, so there is a strong inter and intra-sectoral linkages. It is needed from both the parties, from government and from the private stakeholders. So we need to use the situation as an advantage for the source states, because it is important to create the training session for them. It is important to create or it is important to provide access to minimum level of economic and social security. So I think I am done with this discussion, but I would like to I would like to say one line before leaving this discussion, that inequality will be there for a few more years, or maybe 100 of years, I don't know. But one thing is that this pandemic has given us the space to think about our consciousness. I know many people who are helping direct neighbors with the food, with meals, with many things. So when we are talking about this situation in the platform like transition, so I believe the transition is not only the transition of technology or science, but transition also for our inner consciousness. We need to connect our inner consciousness with the planetary consciousness that definitely develop our inner soul and our sensibility towards our humanity, towards our society and country. Thank you. And thank you for your patience.
Thank you very much, Keya. Very interesting talk. I think we have a few questions. Katerina?
Yeah, thank you for a super interesting talk, Keya. So we have a first clarification question from Adriana. Adriana, can you ask your question, please?
Yes, thank you. First of all, thank you very much, Keya. It was really interesting to hear the situation from India and see how similar is the situation in inequality that we have here in Latin America, especially in Brazil. And Keya, I have a question. Is there any universal public health system in India, like the NHS in England or the Brazilian universal health care?
Practically, what do you mean by universal? Means it's a kind of connectivity with other donors or other partners in other, so means other countries, or it's a exchange program, or the kind of exchanging their motives or notion or focus. Means what is it like? Means
Maybe I can explain better. No, a public health system fully funded by government and accessible to all citizens.
no, that is not available at this point of time, because marginal people are not getting that kind of insurance or benefit. But yes, there are state government hospitals, and that is very reasonable price. So people can, marginal people and rural people can come and they can do the treatment and thing, and that is very reasonable in price, but definitely not like other countries. We don't have that kind of insurance and coverage, something like that.
Okay, thank you very much.
Thank you.
And for just one more question, and for those really poor people, how they can access to treatment? Only by charity hospitals or charity services?
It's not charity services, it's just state government run hospitals. So they need to go to state government hospitals and state government's primary health centers. So they can go there and do their treatment.
Okay, it's pretty affordable also for them. Okay,
yes,
thank you very much.
Yes, quite affordable. Thank you.
Okay, thank you.
Do we have time for another question, May?
Yeah, the last question, and then we move on.
Okay, we have one more question from YouTube, from the YouTube site, coming from Raphael. Raphael, could you ask your question, please?
Raphael is muted.
He is muted.
Oh, okay, sorry. Do you hear me now? Thank you.
Yeah.
Thank you, Kea, for the presentation. I asked before in YouTube how the pandemic affected the investments on online learning, but you already answered that on your presentation. But I still got another question. Can we trace any relations between these impacts on inequality of education and health and gender inequality in Indian context? I mean, generally, women are responsible for family care, and someone is in charge of education and healthcare of the senior people and the children at home right now. Do you see any relations or something is worth mentioning on this relation?
Yes, there is, but if I keep on discussing on that, it will be kind of too long story. Yes, definitely means there is a gender biasness. It was there before pandemic, and now during pandemic, it's kind of intensified because there are, as I told, there is a helpline, though it is a child helpline, but still it's a helpline for women, but it has increased a lot, this domestic violence, and even the when we are talking about the job area also, workplace also, there is a impact of this pandemic for gender biasness and for men, women, inequality or imbalances in that way. Yes, it is really another kind of topic you could say.
Okay,
yes.
Thank you, Kea.
Thank you.
Thank you very much.
Thank you.
Very, very interesting. And now I will ask Bipashi to enable the poll. We're going to have a poll where we're going to ask you to answer it, where you're from. We're interested in seeing what is the coverage that we're having of participants and attendees. So let us know, Gashi, when it's enabled. And now
it's enabled.
Okay, thank you.
Let's wait for maybe 30 seconds for everyone to respond.
In the meanwhile, I'll go just introducing Felix Cuevena Doncor, who is our next speaker. He's getting ready for for his presentation. He's a postdoctoral fellow at the College of Agriculture and Environmental Science, UNISA, in South Africa, member of Future Earth Knowledge Action Network on the Food, Water, Energy Nexus and the Early Career Network. He's also a deputy of the South African Adaptation Network, .NTI, and Climate Justice Forum at the University of Witwatersrand. Shall we proceed, Rashi?
Yes, just to share the results of the poll before we start with Felix. We have most participants from Europe so far, and some participants from Asia, Oceania, Latin America, East Asia. That's all for now. We'll go to Felix.
Okay, amazing. Felix, are you ready?
Yeah, thank you.
Okay.
Well,
all yours.
Can you hear me? Okay.
Sorry?
Good afternoon, ladies and gentlemen. First of all, thank you so much for the opportunity to take part in this discussion.
Would you like to share your screen for the slides?
Okay, I shared the slides.
Thank you. So far we are 39 participants at the moment. As Vipashi was saying, we're from all over the globe. That is very interesting. It's going to be an amazing further discussion. Remember that we have half an hour by the end to continue sharing our knowledge, our thoughts, and everything. Do you have them there?
Yeah, I have it.
If not, maybe Vipashi, can you share them?
Yeah, can you share from your side, the one I sent to you?
Yes. Just let us see. Vipashi, do you have them?
Yes, give me a second.
Thank you. Yes.
I don't have the slides of Felix.
Just 1 minute that we arrange this.
Yeah, I have it now. Okay, I will share my screen.
Thank you, Vipashi.
No worries. And I share my PowerPoint. Yeah, just let me know when to go to the next slide, Felix. And
okay, thank you so much.
We can go.
Okay, so good afternoon, ladies and gentlemen. Thank you so much for the opportunity to take part in this discussion. So I'm talking about how the food situation has underscored some of the inequality in my society and how some of the measures we need to take to address them. So access to food is essential to optimal development and function, both in children and adults. And especially at a time like this, in the time of this pandemic, where we need healthy nutrition for people to be healthy, to assuage and then keep them safe in this period. The importance of access to good food cannot be overemphasized. Because of the importance of food, it is enshrined in the 2030 Agenda for Sustainable Development in Goal 2. Food security is also a core component of all the human development and capability paradigms, since food access and entitlements are critical for reinforcing essential human capabilities. Nevertheless, more than 800 million individuals globally do not have access to enough food. More than 2 billion individuals also experience micronutrient deficiencies, and more than 60% of individuals in low-income countries are food insecure. You can go to the next slide. So let's come to some of the conceptual definitions. When we talk of food security, we are referring to access by all people at all times to enough food for an active, healthy life. Food security includes, at a minimum, ready availability of nutritionally adequate and safe foods, an assured ability to acquire acceptable foods in socially acceptable ways, example, without resorting to emergency food supplies, scavenging, stealing, or other coping strategies. Food insecurity, on the other hand, refers to limited or uncertain availability of nutritionally adequate and safe food, or unlimited or uncertain ability to acquire acceptable food in socially acceptable ways. Then hunger is the uneasy or painful sensation caused by lack of food, the recurrent and involuntary lack of access to food. Hunger may produce malnutrition over time. Hunger is a potential, although not necessary, consequence of food security. In South Africa, the cause of hunger and malnutrition is not really due to shortage of food, but rather inadequate access to food by certain categories of individuals and households in the population. For example, among the poor, or in the South African economy, these are people whose main sources of income are peace jobs, social grants, and remittances. And this category often fall into the food insecure population. Some of them include remote rural populations, families with members who are chronically ill due to HIV/AIDS or tuberculosis, people with disabilities, the elderly, widows and divorced women who become vulnerable due to loss of previous partners' contribution to household livelihood or loss of access to rights and assets such as land, low levels of paid employment among women, female-headed households, women and girl children. Amongst this group, what happens is that they share the amount of money spent on food per their budgets can amount to as high as 42%. And countrywide, we have more than 20% being categorized as food insecure. With the onset of the coronavirus and then the measures which were put in place, we've seen a spike in food insecurity, especially amongst these populations. This is also due to disruptions in domestic food supply chains and other shocks due to production, loss of income, and remittances, which create strong tensions and food insecurity. As I mentioned earlier, because the percentage of money spent on food among such groups is so high, in this period where there is loss of livelihoods, for example, people are being retrenched, in this period where remittances are not forthcoming, now the means to get access to such sources of food becomes a challenge. And that brings to the fore the idea to look at alternatives of democratizing the food systems and making it more accessible to all. During the pandemic, we had cases of some of the big distribution companies colluding and then fixing prices, making things out of the reach of some of the poorest of the poor in the country. Later, our informal food suppliers, initially they were not allowed, but then later they were given the permission to now go ahead and then distribute and sell food. This points to the need for addressing our local food system. For example, it shows that our small-scale producers and informal food producers need to be given a greater role to enhance, to limit such situations of price collusion, which escalates the prices higher beyond the means of the poor. Furthermore, greater penetration and involvement of these informal traders and small-scale producers in times in times like this, like this pandemic, makes and enables food to reach some of the poorest. We had situations where the food deliveries were being hijacked and then were being vandalized by people who were hungry and didn't have means of accessing food. Another means is to encourage production, local production in some of these vulnerable areas. And by means of encouraging homestead garden and then community gardening. In many of the rural areas, often people engage in barter trading. So that means if I have my garden, another person has his garden, I can exchange cabbages for nuts. Somebody can exchange bread for carrots, etc. But then in times where you don't have anything to barter, that means you can't contribute to the cycle. Then to enhance the production and then help alleviate the challenge of food insecurity, we have to preserve, we have to encourage and preserve critical humanitarian food, livelihood and nutrition assistance to vulnerable groups. These are augmented and adapted to COVID-19 impacts. Unfortunately, because of the impacts of COVID-19, more people will still be dependent on government support in terms of social grants to be able to fend for themselves. So we'll also have to expand real-time food security monitoring systems to provide timely, improved, and especially indicated data to measure the pandemic's unfolding effects and understand better who is suffering from hunger and malnutrition and where they are. In South Africa, this is more so because we already have a big pandemic with respect to HIV already being in the system, so which means that a lot of people will have already compromised immune systems. So improving access to nutritious food is one way of helping us keeping more people alive and saving households. So also ensure relief and stimulus packages reach the most vulnerable, including meeting the liquidity needs of small-scale food producers and rural businesses, particularly those led by women and young people. The pandemic has demonstrated the role of women as care providers, essential both at the household and community level, and are supported at the international level in a coordinated manner that is responsive to evolving needs. We also need to strengthen our social protection systems for nutrition. Given the socioeconomic effects of the pandemic, social protection systems will become the mainstay of hundreds of people for the duration of the current crisis and possibly beyond. Food nutrition assistance needs to be at the heart of our social protection programs to protect food access for the most vulnerable by increasing their purchasing power and, where necessary, by directly providing food through government or community-based programs. Must also strengthen the health system response for nutritional care to ensure the continuity of nutrition services, particularly the early detection and community-based management of acute malnutrition, infant and young child feeding, as well as related maternal nutrition programs nationwide. And in saying this, the I mentioned earlier that food security is very crucial to optimum human development, cognitive development, etc. Which means that in a society which is often regarded as one of the most unequal in the world, when we fail in this manner, amongst the poorer sections of the society, we further exacerbate the situation of inequality in the sense that the human development dimensions in the poorer sections is further worsened, and then the inequality overall it's not alleviated, or we are not able to address or limit the impacts of inequality in the society. So I'll say that food security is related to all the United Nations Sustainable Development Goals, and an optimal physiological, cognitive, and emotional development and function in both children and adults require access to food of adequate quantity and quality at all stages of the human lifespan. Improved food security governance based on sound, equitable, and sustainable food systems that benefit from modern information and sustainable and equitable agri-technologies is essential for countries to meet the SDGs, especially in our current situation. All right. Thank you. Okay, gosh, I think I've finished the slides.
Sorry? Thank you, Felix. Thank you very much. That was also a very interesting talk. We don't know if to go further with the slides, but you did wonderfully. So, Katerina, do we have any questions at the moment?
We have a clarification question from YouTube, and yes, thank you, Felix, for your talk. We have a question for you, Felix. On YouTube, people are asking, are community gardens popular in South Africa? Is there local government support for them in major cities?
Thank you very much. So community gardens are gaining. So there is community garden, and then there's homestead garden. So the homestead garden is where behind your garden you may engage in growing something to support the family. Then community garden is where a number of people come together, and then a patch of land in the community, they come together to grow crops there, and then they share it. So it is growing in popularity, and it's amongst some of the NGOs and civil groups. They are promoting community gardens as a way of helping, especially the very poor communities, also access nutritious food, and also to help themselves, especially in times like this where movement is restrained and you cannot, and then there's a need to build the local food systems. So I would say that they are now on the rise, and there's been a push to government to get more involved in this so that the locals at the grassroots, food security can be enhanced at the grassroots.
Thank you, Felix. Thank you very much. I think that we should now move to our next speaker. Just for all our audience, remember that we're using the hashtag Global South Webinar. You can follow us on Twitter, and we also have a mailing list that if you're interested on receiving further invitations, please let us know so that we can include you there. Now we're gonna hear from Melina Galdós Frisancho. She's a doctoral researcher at the Science Policy Research Unit, SPRU, University of Sussex, United Kingdom. She's coordinator of the Science, Technology and Innovation Policy Group at SPRU and Science Policy Director at the Peruvian Civil Association Científicos.pe from Peru. No? So we welcome you here, and she's going to be talking about inequalities and the COVID-19 outbreak What can we learn from wholesale food markets in Latin America? All yours, May.
Thank you. Thank you very much, May. I'm going to start sharing my screen. And please let me know if you can see it.
You can full screen.
Okay. Am I on full screen now?
Yes, perfect.
Okay, great. Thank you. Thank you very much. So my name is Melina. I am from Peru. So this talk has a focus on Latin America. First of all, I wanted to really thank all the organizational team for inviting me to give this talk, and also to Keja and Felix for their really interesting insights on this topic. I would like to also thank you all for being here and taking the time to listen to us and to exchange some perspectives and ideas about this really interesting topic for us in the Global South. So the title of this talk is Inequalities and the COVID-19 Outbreak. What can we learn from wholesale food markets in Latin America? This talk is actually not based on my research, but I thought that this topic could help us to think about how transition frameworks can change to better meet the complexities of the cities in the Global South. So the point of this presentation is to use the case of wholesale markets in Latin America to reflect on how inequality has worsened the negative impact of the COVID-19 outbreak in the region, and to provoke some reflections about what can change if we try to look at wholesale food markets and its dynamics as an important part of, or as an important component of the food provision socio-technical system. So this is the overview of the talk. I will start by reflecting on the central role of wholesale food markets by presenting to you the case of Lima and Mexico City. I will be focusing on two particular markets. Then I want to reflect on what's at stake, and particularly on three variables: informality, lack of access to basic services, and financial exclusion. Then I would like to jump into transitions a little bit and reflect on how can transitions theory help us to understand the complexities that shape the behaviors, the patterns, and the understandings of the people who interact within these spaces. And then finish this talk with a very brief slide about how can we start thinking about alternative pathways in the food provision sector. So I would just turn on my timer to make sure I hit the correct time. Okay. The central role of wholesale food markets. Wholesale food markets in some cities in Latin America have been often overlooked by governments as a space for policy interventions, despite their key role in society. Wholesale markets are spaces where different variables interplay. If you think about nutrition, local development, social integration, food provision, and economic development. However, despite their key role, they are facing infrastructure and obsolescence problems. Moreover, the food provision governance in some of the most important markets in Latin America is highly decentralized and complex, and it's usually populated by private actors that not necessarily come together to make coherent and centralized decisions. On the contrary, like it has this preponderance of private actors has prevented to take decisions that are coherent in order to address this pandemic during the COVID-19 outbreak. So the COVID-19 has unveiled the precarious conditions of these key spaces where social relations are reproduced every day. Therefore, when countries such as Peru and many others in Latin America raise the question of why quarantine measures were not working as anticipated, many were not really surprised to realize that the combination of precarity and a design that favors concentration and rapid exchange led to wholesale markets to become what we call them now, hubs of infection. To illustrate these points, I want to present the cases of the Central de Abastos in Mexico City and the case of the Mercado de Productores in Santa Anita, Lima. On the one hand, Mexico City Central de Abastos is the Latin American biggest food market. It supplies food to 22 of Mexico's 32 states. Supermarkets, restaurants, and families rely on its 90,000 workers who are visited every day by about 300,000 buyers and delivery personnel. If you can see here in this picture, the scale of the market is huge, and you can see how it feeds 90,000 workers and 300,000 buyers every day. Inner city market spaces really have not been a subject of regulation in Mexico since 1950. And when the outbreak began and the government started to display health workers to test retailers in these markets for COVID-19, they realized that about 1 in 5 workers tested positive. Of course, it was a small sample of retailers, but if we think about the scale of people who visit this market and the potential chains of contact that can be sparked by one person with a COVID case, then we realize that the impact of having Central de Abastos in Mexico City as a hub of infection is really huge. The case is not really different for Lima and for the Mercado de Productores in Santa Anita. This is one of the 3 largest markets that provide for 1,300 inner city markets in Lima. It has approximately 30,000 merchants, porters, and suppliers, and receives the visit of nearly 40,000 buyers every day. As you can see, the scale is not as big as Central de Abastos, but is also huge and very prominent for a city of 10 million inhabitants, which is Lima. As in the case of Mexico, inner city market spaces have not been really subject of policy interventions in the last 30 years. Actually, when most of the markets were privatized during the 1990s decade, barely few interventions have been made in order to improve the quality of the markets or to try to help to improve the conditions for retailers. So when the COVID-19 outbreak started, the Peruvian government sent also health workers to start testing the retailers and the people who worked inside the Mercado de Productores de Santa Anita. And they realized that approximately 70 retailers gave positive to the tests. But not all the markets have become hubs of infection. So this invites us to think what makes these cases particular. If we focus on the physical and internal aspects of the markets, then we can see that both share in common the lack of infrastructure maintenance, which has led to the concentration of waste in situ and the appearance of different plagues. But why is this important in the context of the COVID-19 outbreak is that this waste in situ and the plagues could lead to mutations in the COVID-19 strand. But moreover, there's a lack of uninterrupted piped water supply. There are several barriers to access to toilets. For example, if one retailer wants to go to the toilet, they need to pay a fee in most of these markets in Lima and in Mexico City. And even if they decide to pay the fee, they might not find running water inside the toilet. So it's really, really difficult to comply with these measures of washing your hands constantly or deciding to give a portion of your very precarious income every day to access to the toilets. Also, these markets have in common that cash exchange and products exchange take place rapidly, faster in high quantities, because these markets are designed for that. It's not that you can buy online and you will have like the delivery personnel taking this product to you. So that also helps in the spread of the COVID-19. But here's a very interesting paradox. Food provision systems have developed high standards in terms of quality and salubrity for the external markets. Peru and Mexico are countries that export a lot to the European Union and to the United States, and they needed to develop certain measures to comply with the quality standards that those countries imposed in our exports. But we haven't been able to develop high standards in terms of salubrity and quality for internal markets. That's why we see the precariousness and the mess that we see in our wholesale market and the most important wholesale food markets in both capitals. So what are the wholesale food markets telling us in the unfolding of the COVID-19 pandemic? I think that they are telling us that there are variables, visible variables that have led wholesale markets to become hubs of infection. These variables are related to the patterns of behaviors that take place inside the market, like, for example, not washing your hands, exchanging cash, concentration of people. But if we try to go beyond what's visible within these spaces, we can understand that there are other variables that shape the routines and behaviors that we actually see within these markets. Here you can see 3 maps of Mexico City. The first one is a map of household overcrowding, which is an indicator that tells you about how many people lives in a household and how many people share one room in the household. When you have a household, when you have a case of household overcrowding, you would have 4 people or more sharing one room within the household. If you see the second map here, it's water provision, and there are 3 different problems that have been reported related to leaking, lack of access to water, or use of alternative means to get water, like tanker trucks. And the last map here is a map of the COVID-19 cases. The very red municipalities are the ones that had more than 2,250 cases. And interestingly, Mercado Central de Abastos is located in the Iztapalapa municipality. You can see this square in all the 3 maps where it is located. Coincidentally, this is a poor municipality that faces problems of household overcrowding, water provision, and has reported to the date about 6,000 cases of COVID-19 accumulated since the government started taking, measuring the cases. So this is telling us that in a municipality that is poor and albergates the biggest market in Mexico City, you have people that not only don't have access to water provision, that live over in an overcrowded house, which facilitates the spread of the virus inside a household, and also has reported more cases. The people who live in this district are constant buyers in this market and are also part of, represent a huge part of the workers. The case of Lima City is not really very different. If you see here, there are 3 maps. The first one speaks about urban density, the second one is household overcrowding, and the third one is water provision. These 3 maps combined would tell you about risky environments in Lima City. And the Mercado of Santa Anita is located also in a poor municipality in Lima, and that also faces problems of urban density, which would worsen the spread of the virus outside the household, faces problems of household overcrowding, which will worsen problems of spread inside the household, and finally problems of water provision. So what's at stake? There's a lack of basic services that was caused by rapid and unorganized urbanization, both in Santa Anita and in Iztapalapa. Moreover, in Lima and I guess in Mexico, they face a similar situation. 21.9% of the households do not have a refrigerator. That is, one poor household per every 5 households has a refrigerator, which pushes people to go every day to the market to buy the food they need because they cannot store it for longer periods of time. This speaks to us about the impossibility to take basic measures and change routines and behaviors like stay at home during the quarantine, because this is just not possible. What's at stake as well is informality. Peru, 70% of its labor force work is in informal or unregulated economy, and about 40% are self-employed. This is the highest in the region. Half of Mexican workers hold informal jobs as well, with no unemployment insurance. You can see here the people who actually carries the products and help people to transport things are the ones that are facing these main problems. There's a need of earning income daily, and the vulnerability of workers across the food provision chain to face access to quality service and leave payments. Finally, most of the population that is in this situation suffers from financial exclusion. There are, despite the cash transfer programs that were implemented in Peru and the loans that were made available in Mexico, they, like most of people, do not own a bank account, so they were pushed into risky environments and risky situations to see whether they were granted a cash transfer, and if they weren't, because there were problems in the distribution of those financial economic measures, they had to keep going out every day to work, keep going to the market to get whatever they could and take it back home, making the situation of the COVID-19 spread more salient and poignant in these particular municipalities. So this picture is really interesting and really touches me, because this happened at the 1:45 a.m. in Lima, outside the biggest wholesale market. But both buyers and retailers were waiting outside. This was after all the protocols and measures were put in place to prevent the spread of the COVID-19. But you can see people is just waiting outside. They are not respecting the 2-meter distance, or they are not queuing properly, because their need pushes them to not change the routines and behaviors that they had before the quarantine. And if they see that they cannot access to their workplace, or they cannot earn money to provide for their families, they would care little about the measures and just push this forward. So the variables we discussed before shape people's routines and behaviors that, even when protocols and measures to prevent the spread of COVID-19 virus were implemented, are reluctant to change. But how can transitions theory help? And this is one of my last slides. So there's an acknowledgement that sustainability transitions frameworks need to better account for the heterogeneity and uniqueness of actual existing socio-technical regimes in cities in the global south, so that planners, policymakers, and donors might better develop alternative pathways to secure, to just secure and sustainable futures. In this sense, I thought that it was really interesting what Welly et al. Did in terms of trying to understand the complexities that shape our sectoral regimes in the global south. And they came out with this really interesting distinction between service regimes and sectoral regimes. So a sectoral regime refers to the provision of broad societal functions. Food is one of them. And although they did this exercise, particularly for the case of sanitation in Nairobi, it really makes us think that we don't necessarily have one sectoral regime in the food provision. For example, wholesale markets are competing also with supermarkets and big chains, and there are different ways to provide food and different combinations within these spaces. In this sense, service regimes, not as it stands, but it's an interesting category that actually picks or builds on routinized practices and shared understandings in order to unveil what makes a service regime stable. And when we think about how can we use transitions to better understand the case of wholesale food markets and in this context of the COVID-19, I was thinking that maybe we can just take examples like this that were were really tailored for complex urban cities in the global south, and try to reflect how can we better understand routinized practices, shared understandings, to try to think about better and more sustainable futures. So just to conclude, the unfolding of the COVID-19 is showing us how urban spaces are configured, but more importantly, how we share them and participate in them, like in the cases of the wholesale markets. But also, in order to use transitions, we need to rethink their conventional frameworks to meet the complexities of the cities in the global south and the complexities of the different sectors that might cut across the reproduction of social and material life in our cities. Focus on routinized practices and shared understandings can actually help us to think about more tailored concepts and ways and lenses to understand these complex realities. And for that, we need to use grounded approaches and identify differentiations and their characteristics by focusing on top-down ways of building this new understanding. So we can actually co-imagine new pathways to move towards more sustainable and just systems. And I think that will be it. There are some references that I used today, and thank you so much. I will stop sharing my screen now. I hope I'm not over the time, May.
No, Melina, thank you. You were perfect with time, very organized presentation. I will give it directly to Katharina because I believe we have a few questions for you.
Yeah, we have a few questions. Honestly, there are, I have not seen a clarification question specifically for you, but I really enjoyed your presentation, Melina. Thank you very much. That was fascinating.
Thank you, Katharina.
So I was figuring maybe we could just open the panel floor for everybody right now. We have some questions for everybody from the audience. We have, let me see right here. So maybe all you panelists could turn on your Felix as well, your cameras, and then we can have a little discussion. So I'm going to be calling on people in the audience to ask their questions, and we are going to start off with Claudia Santos. Claudia, hold on a sec. Let me turn on your. Oh, Claudia, I think, do I see her? Fine, I will ask her a question. So Claudia says, economic growth is not compatible with good health and sustainability. And this has been one of the major criticisms towards the SDGs. How can we beat inequality in India, in Peru, in Mexico, in South Africa, without promoting growth, especially when increases in GDP are largely benefiting a small fraction of powerful individuals? Then we have Lewis. Huh?
Shall I respond to this question, Katrina?
I was thinking maybe we should gather them. What do you think, May? Or do you want to, if you want to respond one-on-one?
It's your call, Kata.
Okay, yeah. I mean, Kaya, if you want to respond, please go ahead.
Yeah, definitely. So it's a really very interesting question, and it's a kind of arguments that's happening all over the world since last 20 or 30 years when this HDI is launched, that is Human Development Index. Over there, it is said very specifically that GDP or per capita income, that is PCI, whatever be it, it should not be the sole factor for, what should I say, for counting any society or country's well-being. Because when we are talking about well-being, it should be a kind of holistic approach. It should be sustainable well-being of in terms of health, in terms of education, in terms of happiness. So there are lots of indicators like happiness index, livability index, quality of life index. So that's why those kind of indices are developed, because GDP and PCI and these very, very conservative indices or very, very conservative analysis are those are the counter arguments of those kind of theories or those kind of indices. So that's why it's a very nice question. It's not only GDP, but we should take care of the health, education, and other associated socioeconomic sectors to know what is the real situation or the ground situation of a particular society or a particular country. Yes.
Mm-hmm. Absolutely.
Sorry, can I add something to that question?
Of course, please.
Okay, thank you, Katarina, and thank you, Claudia, for your question. It's really interesting. I think Ella gave like a brilliant response already. I just wanted to illustrate this paradox with the case of Peru. So when the pandemic started, we realized that we have been taking care of the macroeconomics of the country for so long, since the 90s, that we managed to save a lot, to do really well in the macroeconomic indicators. But when we needed to spend that money into like redistributing it, for example, to help poor families to not go out for work in order to like stay at home and be able to have some extra cash so they can spend, we realized that the governments really, like the preceding governments and this government didn't build the channels to redistribute all the wealth that was accumulated throughout the last 20 years in the country. So that is really, really interesting, and again poses the question of growth versus redistribution, which has been a continuous question in the history of Latin America. And I think if we don't take this opportunity to start changing this focus on overall growth and not thinking about how people is benefiting beyond a trickling down effect from this growth on the light of this pandemic, then next generation should be very disappointed, I think.
Yeah, thank you very much for the question. So like in the presentation, I did mention that, you see, food security has a lot also to do with human development. And as my colleagues have already mentioned, human development, as indicated in the Human Development Index, goes beyond merely GDP issues. In some of the most unequal societies, what you realize is that as the world moves towards a knowledge economy, amongst the poorest, the food issues compromise the development of the very poor. So if their total development is compromised, when it comes to going for the best jobs, the children of the poor will not have developed the skills to access those kind of jobs. So it's only the children of the very rich. And then in the end, the cycle of inequality is worsened and is replicated. That's what I was mentioning about food security amongst the very poorest and vulnerable areas. So that's also one of our ways of, it's not the only way, but then it's also one of the ways of alleviating the issues of inequality in the society.
Thank you to the panelists. Katerina, do we have other questions?
Yes, we have a question from Adriana. Adriana, do you have your microphone? Oh, I'll turn your microphone on again.
Yes, I have my microphone. Thank you very much for all the presenters. I think what was really, really interesting. And I was thinking regarding the three presentations, just made a comment. I think it shows very similar situations because we see in the back of all these inequalities is the absence of the state, the absence of the institutional role of the state in providing kind of stable regulations and infrastructure. When we see the case of the COVID-19 infections in wholesale markets due to lack of water, running water, I think it's incredible. It's something that in 2020, we discussed lack of running water in communities. I think it's unacceptable. And I think it really exposes how this neoliberal policies that has been taken, especially here in Latin America for the last 30 years, had really put this behind. As Melina said, it was the same here in Brazil, that we had the economic growth, we had the macroeconomic stabilization, but really poor reduction of inequalities. Here in Brazil, we still had a period of reducing inequalities, but since 2015, with the economic crisis, the inequality is rising really high. And I think also, besides the role of the state, we have the role of the social innovation as a way how to make this cycle, how to break this cycle, really. I think this solidarity and the role of grassroots innovations, I think it's really interesting. As Felix mentioned about this community production of food, I think it's really important. It's a way of including, a way of how to making, to lower these inequalities and the access to food. But I think they must be together. The role of the state providing the infrastructure, regulations, infrastructure like water, electricity, and so on, and of course the social innovation. And I think this must be somehow acknowledged by our transitions theory. But thank you again for the presentation. It was really interesting, and we have a lot to think about.
Thank you, Adriana. I think we have 3 more questions, if I'm not wrong. Katharina?
Yes, we have a question from Rajashri, Rajashri, I'm going to turn your microphone on so you could ask your question, please.
Yeah, I'm Rajeshri from Kolkata, and my question to Dr. Kia Chakraborty, is that whether the impact of COVID-19 has something to do with gender issues, especially in the rural households of developing countries like India, because are the women sections more vulnerable to this pandemic situation? This I just wanted to know from Dr. Kia Chakraborty. Thank you.
Yeah. Shall I, Katrina?
Yeah.
Please,
Okay.
please.
Yes, thank you for the question, Dr. Rajeshri. So yes, definitely there is an impact of pandemic in the rural economy as well as urban economy. So when we see that migrant laborers are going back home, and they have lost their jobs, and as I also mentioned in my presentation, that there is a child helpline number. It is not for only child, but also for women helpline number. So lots of calls are coming due to this, domestic violence and sexual harassment and abuse and something like that, because it's a kind of this, you can say it's a kind of jeopardy in the present situation, that out of frustration, this gender biasness has kind of affected a lot. And okay, shall I put more input over here, or it's fine for you?
No, it's okay. I have understood what you
Yes.
are trying to clarify. Thank you. Thank you so much.
Yes. Thank you. Yeah.
Okay, so we have a question from YouTube, from Raphael as well. Raphael, can you ask your question, please?
Yes, sure. Thanks, all the panelists. I have a little clarification question for Felix. I'm a researcher on community gardens in Curitiba, South Brazil. And in my city, we are seeing gardens in endangered activity because of faced by the community. Community gardening is like a social activity, and as so, isolation measures make the gardeners afraid of going to the gardens, and everything is working much worse than expected as a food security measure. And if you think that might be something like that in South Africa community gardens, or the context of the COVID-19 crisis may still keep this kind of community garden a popular option for food security.
Okay, thank you very much for sharing this. So on the contrary, here in South Africa, the community gardens are also seen as a means of social cohesion. So as you mentioned, it's a means of socialization for the members in the community to come together in solving some of the basic issues in the community. For example, access to food. And with the COVID-19, where it has become, food has become higher, prices of food has increased, access to food has worsened. It has made this idea of community gardens rather popular, and rather people becoming more interested in community gardens and then homestead gardening. Also, that means also producing food for themselves. Why is this so? It's also because, you see, with COVID-19, we've also learned that quality and nutritious food is very important for building your immune system. So people have also become more interested in these gardens, because then it's a means of them producing quality and nutritious food for themselves and their families. This has all made it the debate for them more popular, from my observation.
Okay, thank you, Felix. It's very nice to see another perspective of development of community gardens.
Okay, thank you for that. And we have a question also from Louis, or several comments and a question from Luis.
Thank you so much, Katharina. I'm originally from Venezuela. I've been living in Canada for some time now. And I'd like to thank everyone. I think it's very interesting to hear these stories and more cohesive around our regions. Also to see the similarities on the challenges. I think that's very powerful. Since if we are able to further understand the similarities, we can also implement similar solutions. One thing I like to say, for those who know the region, Venezuela is particularly concerning case of economic challenges and political unrest. But it's been quite one of my biggest concerns is the human rights defense. Since a lot of the COVID measures in the country have been actually attempting against human rights. People are being tested by force, be held against their will in conditions that people are very scared about being held by the government, because they have these facilities have no guarantee of running water, no guarantee of electricity, no guarantee of food, and that had created a lot of clashes of the population and the government, specifically in my region in northwest of the country. People burning transportation vehicles where they were taking people to these facilities. They were closing down markets. So there is a lot of social resistance since there's no trust in the government actions and policies. So I think overall it's very concerning, because we are aware how sensitive and how unstable systems, I would say, overall systems are, at least I cannot speak for every country, but at least in my country, healthcare system was already in collapse. Food supply was already in collapse. The economic sectors were already in collapse. They were in collapse when COVID hit, meaning that as a society, the structures cannot really hold this shakeup. And I don't think the government has developed clear policies to handle the current situation, either going away from it. So a little bit to anyone who would like to take this question, if there's any, if you are aware or have knowledge or maybe some policies that we could support to first defend human rights, but also support our communities in our countries where they need a lot of guidance and a lot of certainty about what could happen, what's going to happen, what type of measure to take, and how to support moving from COVID once we develop more herd immunity or there's a vaccine available. So it's quite critical, and I'm using this platform also to raise awareness of what's going on in my hometown in Venezuela, but also sharing this platform to have a honest conversation about what is it in reality, some potential measures we can support, but also when the understanding, at least in my understanding, that supporting a sustainable transition in the situation where Venezuela is almost unthinkable. I know it's not impossible because it's everything in my understanding, everything is very well connected, but it's definitely not the priority.
Wow, those are some really good questions that I think, well, that I've definitely also been grappling with for a long time as somebody who works and lives in Nicaragua. And I think we have a lot to talk about there, Luis, and I'm going to get in touch with you after this to stay in touch. But which of the panelists, who would like to answer this question first of all?
Caterina, I probably can say something. Thank you very much, Luis, for what you said. As a fellow Latin American, I really feel the struggle and the pain of your fellow citizen, from the people of Venezuela. It's really heartbreaking to know what's happening and to be following this precarious and horrible situation they are facing. I don't have any advice on human rights directly, but I can suggest some measures that can be supported in order to help the communities to survive or go through this outbreak that are related to food as well. Like in several countries, community networks started to be built by the agency of people living in deprived areas. So they found a way to organize between themselves and try to collect the surplus of the food markets that was left. Because what happened is that farmers inside my country, for example, or in Mexico, didn't stop producing food, but people started to buy less food because of the shortage in income, because they were not allowed to go out as often as they used to in order to buy products. So there was a surplus of food that was about to get wasted. So people started to collect those foods, and based on these community networks, create common kitchens. I don't know if that, cocinas comunes, ollas comunes, if that helps, to feed the people who didn't have any kind of income in these particularly deprived and poor areas. So what I read about the case of Mexico and also in the case of Peru is that merchants and sellers, retailers in the markets were willing to give the surplus of food for free to prevent that surplus to get to waste. And if that was having an impact to feed people, they were happy to contribute on that. So there are values, there's solidarity, and there's a sense of belongingness that has contributed to mobilize the agency of these actors and build these spaces in which they help each other. So maybe that's something that can be pushed in Venezuela if it's not happening now.
So can I add something as Marina discussed just now?
Yes, of course, please.
Yeah, thank you, Liz, for this honest discussion, really. Because yes, though whatever you were talking over here regarding policies and regarding this planning and strategies and all, it's a kind of discussion we are doing as a academician or the researchers. But in reality, the situation is not so far good. But in India, I can tell you that when this pandemic started, that time the situation is not good. While people are going, means forced to go to the quarantine, and it was kind of institution quarantine. But now it is the case is not that much. Actually, from government side, it's not that much. A rule is not that much strict, and they are not forcing. If anyone is having positive or something like that, then the means a few areas are sealed like that. It's not that much very forceful like before, because daily we are having patient like around 20 to 20 to 2,000 to 25,000 sometimes. So it's very difficult, like means country like India, where health system is not that much solid. As I discussed in my presentation, that there was only 8.5 beds, means roughly 10 beds for 10,000 people, or 8 physician for 10,000 people. So it's very difficult to handle the entire situation. But government is government is telling to every people to take care, to improve the generic awareness for the entire people, with the help of phone, with the help of other TV, television, radios, that you need to take care of yourself, because of our health system is not that much robust. So I could say that we had kind of 1.5 months to 2 months lockdown situation. This lockdown means entire lockdown. So that time government has used that time to make the people aware, make the situation handle, and make some better institutes and hospitals to handle the entire situation. So I would say that situation is not that much bad like before, because in India also the daily improvement, it also means, if you say that people are infected, means per total population is 22,000 daily people are getting infected, then again 16,000 to 20,000 people are also improving their health per day. So I would say in that way, government as well as the private sector, the other stakeholders, they are jointly doing a very good job. Yes. Thank you.
Thank you, Keya. I think that Adriana, do you have your hand raised? You want to make a comment?
Yes, I would just like to make a comment about this issue about Luis said, and your comment about Nicaragua as well, about this very concerning issue, and also about what about in India, about this human rights, this opposition from human rights and COVID. I think we have here in Brazil another side of this coin, as we can say. Our government is, of course, right-wing authoritarian as well, but it's in denial for the COVID-19. The federal government is constantly minimizing the impacts and really the severeness of this pandemic. For example, last week, the president has issued a veto in the law that was making obligatory to wear masks in public. He said that it's not obligatory, it's not mandatory in Brazil to wear masks in temples and in shopping centers, for example. It's amazing. And now, I don't know if you may have known, Bolsonaro has tested positive for COVID-19. I think it's an irony. It's extremely ironic, this. And that's another way of how to, he used this argument that it's people should be free to wear masks or not. So it's another way how to deal with these human rights, but in a very bad way. When you enforce, when you tell people not to wear a mask, I think it's something, it has also to do with this issue of human rights, how to treat the liberty of people in dealing with the pandemic, and how bad governments are really bad for the population, like in Venezuela or in Nicaragua. I think it's really amazing what's happening in some places of Latin America, and sometimes in India as well, as we were commenting here. It was just that. Thank you.
Thank you, Adriana. Katarina, do we have any other question or?
Well, actually, I have a question that I was that also relates to what Adriano was talking about. Thinking also about human rights and that we haven't really that the panelists have touched upon, but that we haven't discussed specifically, is also the question of migration. Like, what kind of? I mean, of course, we see this incredibly starkly in India, right? The forced migrations due to COVID, and I'm wondering how this has been playing out in your specific areas, like in Peru or Mexico or in South Africa, and if there has been more voluntary or involuntary migration of people moving from one place to another, maybe moving back home because they lost their job in the city, or if we are seeing such things also emerging in different areas. So I'd be really interested to hear what the panelists have to say about that.
Yeah, thank you very much. So what we observe here is people moving from the urban areas and going back to the rural areas where their families are. Or more often it's because people have, with the lockdown, people were either, for those, if you are working a certain number of hours, which helped you to live a certain kind of livelihood and then pay your rent, etc. In this period, people have lost the number of working hours. Others have been asked to be on leave until further notice. So staying in the urban area where you cannot pay your rent, you cannot feed yourself becomes it's unadvisable. So people have normally moved back to their rural areas, to their home families, where they are able to stay there. They are able to get some food at least from their relatives. That's what has been happening in the lockdown. So government is also trying to reduce movement between provinces because it's seen as one of the ways of the COVID transmissions increasing, trying to reduce the movement between the provinces. That has been some of our challenge here.
So can I add something, Katrina?
Of course, please.
Yeah, so in India, we have seen two kinds of flow. So when the government announced the lockdown, so before that time, means that time around, there are the movement of people, we can say that's I won't say that elite people, but definitely who can do their job remotely. They move to their hometown, their native, because their aged parents are there. Sometimes they don't have to go to office, say for example, for youngs, for bachelors and all. So immediately they went back their home. This is the first kind of flow. Second kind of flow is definitely the daily wage earners. For them, it's very difficult when they are losing their job. They don't have money for their food, for their shelter. So if they lose at least 7 days work also, they are not going to pay rent for their home. So they immediately become homeless. And the owner of that particular home, they are also they're pressurizing them, though there were government protocols and rules that nobody would say to these laborers to go home, or they can't take the rent for a few days. They have to follow those kind of rules. But again, situation at the ground level is different than the theory and the rules and regulations. So there is hundred thousands of laborers went to their hometown, and as there was a lockdown, they went back by walking. There was no transportation. Even they took their wives, their family with them. And there are many news we have seen that due to road accidents, due to starvation, due to exhaustion of the journey, we lost many lives. We lost many young lives. That is very unfortunate for us. Yes.
Mm-hmm. Okay, thank you. And then we have one more question coming from Bipashi. Bipashi, could you ask your question, please?
Yes, thanks. I think that was really fantastic, all panelists. I really enjoyed all the presentations. I have actually two questions, like both are very broad. So I would really like to hear from each one of you about these questions. So one question I wrote in the chat, which is about basically understanding, okay, there is a lot of bad things happening and a lot of issues and difficulties around Yeah, so you talked about the food migration issue, talk about food insecurity, local wholesale markets, and so on. But I just wanted to know, in your own context, what sort of new initiatives or any sort of new projects, initiatives, community level, voluntary initiatives that you have seen or that are emerging in response to this measures like lockdown, or in response to the health crisis and so on. And do you see any sort of positive initiatives that are emerging in your context? And in connection to that, do you see those initiatives have any sort of any sort of leveling impact on inequality in your context? So do you see that in the longer, or maybe in the medium to long term, does this current crisis create any sort of window of opportunity, as we call it in transitions language? Does that create any sort of window of opportunity for a kind of long-term reduction of inequality in the global south? This is a broad question. And then there is also another second question that I had about the kind of global impacts. So for example, as we know, with this lockdown and everything, we have restricted global mobility, right? So there's restrictions in travel, restrictions on trade, export being disrupted. So there's a huge disruption of global value chains. And also, for example, when you have even in the higher education, so people from South Asia come to Europe for studying, and that is being disrupted now. So what sort of impact on inequality do you see because of that, because of the kind of current kind of global crisis and the current crisis have on the kind of future of globalization, as to say? So these are kind of broad questions that I have in mind, and anything you can say around these topics, touching on kind of long-term inequality in your context, as well as kind of global impact, would be very nice. That's kind of my question to all of you. But before I give, can I use this opportunity to launch my second poll? Before you can take some time to think about these answers, and maybe can I launch my second poll?
Yes, of course. Please.
Okay. Yeah. So the second poll is actually about understanding how many of you who are still here, which we really appreciate that you're here and you're listening and you're engaging with the conversation. We really wanted to know for future webinars, what would be your interest? So as you know, we have several themes. This is a webinar series, and this was the second of the webinar series, second webinar. So we wanted to know how many of you would be interested in these different topics that we want to focus on in subsequent webinars of this series. So here you go. These are the polls, and I'll keep it open while our panelists answer to the questions.
So shall I take the opportunity, or Melina, you wanted to?
Well, yeah, I can start. Yeah, like as you wish.
No, please, yeah.
Okay, thank you, Vipashi, for those very insightful questions. There's a lot to unpack, I think, but I perhaps would focus on just two very, very succinct points. Regarding the first one, if something happened on the light of this pandemic that might help us to living in the impact of inequalities, I might not say something directly related to the wholesale food markets beyond what I said about the surplus of food and these community kitchens that started being created, and the efforts that some ministries started to deploy in order to collect that surplus of food and redistribute it in poor areas or peri-urban areas in the city of Lima and Mexico. But what I thought it was really interesting is that this context has pushed research to think beyond the conventional frameworks that we were used to. And in that sense, really interesting efforts were taken in order to, for example, start mapping vulnerable areas for the spread of the COVID-19. And while these efforts now are informing policymakers about where they need to intervene in order to prevent a more poignant spread of the virus, they are showing us what are the areas that are more vulnerable in our cities and why they are vulnerable. So, for example, when we cross this overcrowding with the urban density and the lack of water, and then you see that they are next to the markets, then you see that those are the neighborhoods and the communities that need better and faster policy interventions in order to leverage a little bit the huge inequalities in the poor living conditions that they are exposed on a daily basis. So that's interesting, this role of research and think tanks and experts working all together to show us more evidence on where we need to intervene. I think it's a great takeaway from this awful situation. And finally, regarding your second question, and the fact that, for example, higher education has been disrupted at some point, I would take the positive side on it. And although it's about the people who have the infrastructure and can access to the infrastructure, I think that most of the knowledge that is being produced nowadays is being massified and is more accessible now for people all over the world, just because we switch platforms and we're not doing events face-to-face anymore, but now we're using Zoom, we're live streaming on YouTube. And if you have the infrastructure now, like people in Latin America can access to webinars taking place in India and exchanging experiences like we're doing now, and learning that we are more or less facing the same problems and come about with collective solutions. And that's actually another good thing that emerged from this complicated scenario. So thank you for the questions.
Thanks, Melina. Maybe Kea wanted to.
Yeah, Vipashita, these are the two questions. It's really very interesting, and thank you for that. And as I'm a researcher in inequality studies, so yes, I ended my last discussion with a positive note that I personally believe that transition is not only for this technology and science, but also transition or transformations. It comes within our soul. That's a consciousness. So, for example, there are many startups. I mean, there are many young people are coming in the scenario to tackle the situation with some innovative ideas. Say, for example, some people are doing or organizing a kind of program to how to collect the PPE kit, because previously it was like dumping like anything and it's very bad. So some people are coming up with the ideas how to collect the PPE kits and how to segregate those things. And so many, ideas are going on, and these are all related to socio-technical innovation. So I think also in the health sector, in the education sector, many NGOs, CBOs, and other new startups are coming to handle the situation, and they are closely working with government, because a country like India, it's very difficult to handle entire situation, because there are remote places, there are many marginal people, they don't have access of internet, etc. So they are doing their best job. Means these CBOs and NGOs, they are really working hard for this situation. And even I know personally, I know many people who were not actively were working with the NGOs or CBOs, but they are right now doing a very beautiful job of serving our immediate neighborhood or immediate society. So in that way, I feel like it's, as someone asked a question about inequality, not exactly measured with the GDP, but also the happiness, also about the well-being. So in that way, I'm very hopeful that at least if we see, or if we analyze the entire well-being or as a holistic approach, so it should definitely improve from where we are now. So we have developed our kind of empathy towards our neighbor, towards our housekeepers or whoever daily earner. So it's kind of, individual as well as a collective development of entire society. I felt like so. So that is the answer of your first question. And second question is, yes, definitely, very honestly, if universities in abroad, if they are going to give the scholarship for the students in countries like India and other developing countries, so student means they were always willing to go over there because it's a good exposure for them. But when we are talking about the self-funded student, there will be definitely a disruption of the entire system, because from the monetary perspective, it's a bit difficult, because many students are, as well as talented student, I would say, are there who usually take the bank loan and go over there, study and come back with a good job and do all the kind of what should I say, the formalities and all. So but this time getting the bank loan and also getting the job also after 3 years or 4 years is very difficult. So that system is quite in imbalance as of now. This is my reaction to your question.
Thanks, Kia.
Yeah.
Okay, by Pashi, thanks for your questions. What I'll say is that, you see, the COVID situation has made us see the human face of inequality and appreciate what it means when we talk about inequality. More often when you talk about inequality, it's more of academic discourses. But then today, in the COVID, you can see that people who live in slums are having a hard time respecting the COVID lockdown measures, because where they stay, it's so packed that they cannot stay there. They tend to be moving about. So when you see this on the news, you understand the impact of inequality. When you hear about care workers and then people in the low income areas not being able to go and provide the essential care services, because they cannot do the remote work that people in the high end sections of the community can do. This makes us to appreciate what it means and the effects of inequality in the society. So that's what the COVID has come to do. And it has made people now more proactive and more engaged in finding solutions to the challenges in their community, because they know that in the end, it will come to hit them. In the end, when you find these people who are homeless getting COVID and they are roaming around in your community, in any way, you might end up getting it, you might end up also contracting it some way, somehow. And so nowadays you find groups coming together to organize soup kitchens, organize free delivery of food for people in some of these areas to help limit the desperation and also reduce the unnecessary movements of people, which can also indirectly exacerbate the spike in corona situations. And you can see that so far on the continent, South Africa is leading in the corona incidences. Furthermore, organizations are coming together, developing hunger monitoring systems. We have organizations like the South African Food Sovereignty Council. We also have organizations like Gender CC trying to do hunger relief mapping to see where people are, the hunger hotspots, and then encouraging people to intervene and then also help the people in such areas. You mentioned about scholarships issues. I think for now, what has happened is some of the receiving nations are also now being careful because they feel that the corona is now coming more in the south, in the global south. So there'll be apprehension towards, there's apprehension towards opening the borders to people coming in wholesale just like that. That's what I'm seeing with the issue with scholarships, because also with I did the Erasmus Mundus, and this year we are still waiting to see how it's going to pan out with respect to the students who will go and study abroad for this year. We are still not sure how it's going to work out, because even some of the countries have been banned from coming to Europe for now until the situation stabilizes. Furthermore, in terms of globalization, I would say that the corona has made us to think more of the idea of thinking global, but then acting local, as I say, localization. it has kind of foregrounded that debate more. Thank you.
Thanks, Felix.
Thank you, Felix. And I think we all agree that is these unprecedented and uncertain times that we're living have a lot of reflection to be made. And we want to thank the panelists again for the amazing presentations. I think this will trigger a lot of debates, and this has been such an interesting discussion. Just for the sake of time, we must say that the webinar is coming to an end. We wanted to announce that there's an upcoming, the next event is going to be on the 5th of August, and it's going to be on comparative learning. Fortunately, it's